to this lymphedema. You all know that what is lymphedema. You might have seen at least once lymphedema. This is related to lymphatic system. Let me share my screen first. I hope my screen is visible to everyone. So as I said earlier, this is related to lymphatic system. Throughout the lymphatic system, it goes lymphatic fluid. That all we know. So before moving on to the lymphedema part, we just learn few things about lymphatic system. What are the functions of lymphatic system? What is lymph? These all things we know. So then only we can understand what is lymphedema. Before moving on to the part, let ask one question: what is lymph? Please share your thoughts. Please put your thoughts in the chat box. What is lymph? Any idea? I am waiting here for your response. What is lymph? Anybody? Okay. Finally, I got one answer. It's a drainage fluid. Any other answers? That help to fight against bacteria. Okay. That is one of the major function of lymphatic system. Okay. So, thank you. Lymph is a tissue fluid or an interstitial fluid is collected through the lymphatic capillaries, then enters into the lymphatic vessels, then to lymph nodes. It contains protein, lipids, and water. So, lymphatic fluid is a tissue fluid or an interstitial fluid. Okay. The next one is functions. There are three major functions of lymphatic system. The first function is reabsorb excess interstitial fluid. Wherever the lymphatic fluid is originated, that lymphatic capillaries will absorb the lymphatic fluids from the interstitial space. So that is why the our electrolyte imbalance is maintaining well. Okay. So and fluid and electrolyte balance is maintaining well. And the second, the function is transport dietary lipids. The third one is lymphocyte development and the immune response. These are the three major functions of lymphatic system. If there is any problem happening into the lymphatic systems, these all things will be affected. So this is our systemic circulation. You all know that what is systemic circulation. So you can see that picture from the upper part of the body, the deoxygenated blood go to the superior vena cava. The superior vena cava collecting the deoxygenated blood from the upper part of the body, and the inferior vena cava will be collecting the deoxygenated blood from the lower part of the body. Okay, it finally it goes to the right atrium and then right ventricle. From the right ventricle, it goes to the right and left lung for purification. Okay, with the help of pulmonary artery. So here you can see that there is a capillary and the arterial, the venous capillaries and the arterial capillaries are communicating together. Okay, you can see that picture. And here also, from the lower part and the upper part also, there is a communication between the arterial capillaries and the venous capillaries together. Okay, then finally what happened after purification of the blood in the lungs? The pulmonary veins will be taking the pure blood, the oxygenated blood from the lungs to the left atrium. Then left atrium, with the help of the mitral valve or bicuspid valve, it goes to the left ventricle. From the left ventricles, aorta will pumps the blood, and then again it branches goes to. That is how our systemic circulation is that where that is going. Here, what I am highlighting here is you should know there is a communication between the arterial capillaries and the venous capillaries together. Okay. And the next thing is, if there is a arterial capillaries and the venous capillaries are communicating together, so there is a chance of leaking out of fluid into the interstitial space. Okay. So if there is a arterial capillaries and the venous capillaries are communicating together, there is a chance of leaking out of fluid from the like plasma into the interstitial space. So that fluid will be absorbed by the lymphatic capillaries. That is the greenish color. Okay, lymphatic capillaries. Here you can see that full images. It is clustered. It is look like a clustered line. So it usually the lymphatic capillaries are into the interstitial space. It looks like a clustered. So here, wherever the lymphatic capillaries, the arterial capillaries and the venous capillaries are communicating together, there is a chance of losing out of fluid. That lymphatic capillaries will be collecting from the interstitial space or anywhere. So the next thing is, what is lymphatic capillaries? As I mentioned earlier, it is a single layer of overlapping endothelial cells. You can see that picture. It is a overlapping into the cells, and it has a blind end and more permeable than that of blood capillaries. So that is why wherever the lymphatic fluid or interstitial fluid is there, the lymphatic capillaries are easy to absorb from the area. And next one is lactase. So the second function of the lymphatic system is transport dietary lipids. Here, in our small intestine, there are a lot of the lymphatic capillaries are there. We call lactase. Here, what the lactase do is the lactase will be absorbing the interstitial fluid from the intestine, and also it will be absorbing the lipid soluble vitamins from the small intestine. Okay, so that is why that area lymphatic fluid is look like a milky color. So we usually call tile. So the second major function is transportation of dietary vitamins. The next thing is lymph nodes. So this is one of the major part in the lymphatic system. Okay, from the interstitial space, the lymphatic capillaries will be absorbing the interstitial fluid. Then it goes to the lymphatic vessels, and then it goes to the lymph nodes. It's around 600 to 700 lymph nodes in our body. Wherever the lymph nodes, the lymphatic fluids, it goes to the from the lymphatic vessels, it goes to the lymphatic lymph nodes. Then again, it goes to the lymphatic vessels. Again, lymph nodes. So there are lot of lymphatic lymph nodes in our body. You can see that picture in the picture. You can see that images. Okay, and as I mentioned earlier, located along the pathway of lymphatic vessels, lymph vessels. Then it typically found in clusters. The major function is to receive lymph from the many body regions. So the lymph nodes will be ready to receive the lymphatic fluid from the any body area. So I'll come later. What is the major function of lymph nodes? Then so here we need to understand that there are a lot of lymph nodes in our body that will help to filtering out the harmful substance from the lymphatic fluid. The next thing is, we all know that how the lymphatic system works. The lymphatic system circulate protein-rich lymphatic fluid throughout the body. So sometimes it will contains bacteria, virus, and waste products. Okay, so you have to understand that into the lymphatic fluids might be having bacteria, virus, and waste products. Once the lymphatic system, that lymphatic capillaries will be absorbing the lymphatic fluid from the interstitial space, it goes to the lymphatic vessels, and then it goes to the lymph nodes. Okay, clear? And the third one is, from the lymph nodes, the lymph nodes will be filter out the harmful substance from the lymphatic fluid. Okay, from the lymphatic interstitial space, the lymphatic capillaries will be absorbing the fluid. Then it goes to the lymphatic vessels. Then it goes to the lymph nodes for filtering out the harmful substance. After that, the waste are flushed from the body and clean lymphatic fluid draining the bloodstream. Okay, so this is how the lymphatic system works. So as I mentioned earlier, here the lymphatic capillaries will be absorbing the lymphatic fluid. Then it goes to lymphatic vessels. Then it goes to lymph nodes. Then again lymphatic vessels. Finally, it goes to lymphatic collecting duct, and then it goes to subclavian vein. Once the lymphatic fluid goes to the subclavian vein, it's part of a circulatory system. Okay, so lymphatic system is a part of a circulatory system. Okay. Any doubts so far? Any confusion or any clarification? Anybody need? I hope so far it's clear to everyone. So the anatomy is over now. Now we have an idea about how the lymphatic system works and what are the major functions of the lymphatic system. Now I move on to the lymphedema part. Here, lymphedema is a pathological accumulation of protein-rich fluid enter the interstitial tissue space due to an imbalance between the interstitial fluid production and transfer. Okay, sometimes if there is any breakdown or any damage into the lymphatic system there, the lymphatic capillaries will be working fully. The lymphatic capillaries will be absorbing the lymphatic fluid from the interstitial space, but there is a damage into the axilla. The axillary node is absent. If there is any transportation, if there is any damage into the lymphatic system there is no transportation happening there. So that's time the fluid will be collecting in that part. So that is called lymphedema. Okay, so it is a pathological accumulation of lymphatic fluid or a protein-rich fluid into the interstitial space due to an imbalance between the fluid production and transport. But the fluid production is happening in good way, but the transportation is affected. If there is any transportation if there is any damage there, the lymphedema will be there. Then, now we move to the classification part. According to the International Society of Lymphology, it has to classified in two different ways, primary and secondary. The primary is congenital lymphatic dysplasia because from birth itself, there is a congenital abnormal, small formation of lymphatic system. That time, from the birth itself, the fluid lymphedema will be there. And the second one is the secondary classification is anatomical obliteration of the lymphatic system. So now our lymphatic system is work well and functioning well, but after 2 weeks or tomorrow, we don't know what is happening, what will be happening in our body. If there is any problem, so if there is any problem in our lymphatic system, there is a chance of lymphedema. Here, secondary is again divided into two, non-malignant and malignant. Here, non-malignant patients also getting lymphedema, major road traffic accident. So if there, sometimes the major lymph nodes will be affecting if there is a major road traffic accident there. Major burns. So if there is burns there, again, it will be affecting the lymph nodes. Recurrent infections, iatrogenic, like that is surgery and radiotherapy. If there is a surgery, for example, CA breast, if there is a CA carcinoma breast there, definitely they need to undergo a surgery, radical mastectomy. If the surgery, usually if we do the surgery, total radical mastectomy done, definitely they will remove the adjacent lymph nodes. If there is a removal of adjacent lymph nodes there is a chance of lymphedema into that particular arm. For example, if I have developed a cancer in my left breast, definitely I need to undergo the surgery. So, if I need to undergo a surgery, the surgeon will remove my adjacent lymph nodes too. Why they are removing the adjacent lymph nodes is the lymphatic system is the main part to spreading the infection to one part to the next part. So that is why the surgeon will removing the adjacent lymph nodes too. If the adjacent lymph nodes are removed from my left arm, definitely my arm will be developed. I am the risk persons to develop lymphedema because my lymphatic capillaries are working well, but from the lymphatic capillaries, it goes to lymphatic vessels. it goes to my axilla, up to till my axilla that the lymphatic fluid will come. But my axillary lymph nodes are absent or removed in the surgery period. So there is no way to move to the move lymphatic fluid from the the upper arm to my body. Okay, so that time I am the risk persons to develop lymphedema. And the malignant part is primary lymphomas. Primary, it will be affecting the lymph nodes. So, and then secondary is recurrence. How to diagnose lymphedema? So this is also we need to understand that we need to take a proper history, because all edemas are not lymphedema. Because if the patient is having cardiac problem, or if the patient is having renal problem, or if the patient is having respiratory problem, that patients also develop edema. Lower leg edema and facial edema, these all things will be, sometimes upper arm edema is also there. So we should take, if the patient is having edema, you should take a proper history, whether there is an unknown cause, whether there is a disease related or trauma related, whether there is a treatment related. So then you will get a good idea about why the patient is getting edema. After that, after taking proper history, you should do the clinical examination. So there are 3 stages of lymphedema. The first stage is pitting edema stage. You can see that images, and it looks like a all orange peel skin. If you apply gentle pressure on that area, you can see your finger points there. So that is the stage 1 lymphedema. The stage 2 is the tissues become fibrotic and the tissues are no longer soft, because if you are not treating the lymphedema in the stage 1 period, it definitely affecting that area, and it goes to stage 2. Here the tissues have become fibrotic and the tissues are no longer soft. And the third stage is the tissues are considerably hard and cartilage formation. So these are the 3 stages of lymphedema. And stemmer sign. So this is one major sign which you have seen in lymphedema patients. Stemmer sign. Usually you can able to pinch up your or lift up at the base of the second toe, or you can able to lift up the skin on the middle finger. But in case of lymphedema patient, you can't lift up that point. Okay, so that is called stemmer sign. The stemmer sign is present. You can if there is, that is only one indication for lymphedema. Okay, you cannot fold out the skin on the second toe of the finger, the lower legs, and in the upper arms you cannot lift up the skin on the middle finger. Okay, that is stemmer sign. So these are the other diagnostic methodologies. The soft tissue imaging, MRI, you can do MRI or CT. So then you can get how much the distance how much the extra fluid volume into that interstitial space. If you do that lymph vessel imaging, you can detect any abnormalities. And then bioimpedance spectroscopy, you can measure the interstitial fluid volume. So here, in palliative care, we don't do these all things. We should take only the history and the clinical examination. But as I mentioned earlier, there are 2 major classifications. One is primary and the another one is secondary. If there is any congenital abnormalities there, like that is primary problem, there is any congenital abnormalities there, then you should know, you should do these all things. You have to find out what what is the abnormalities, how much extra volume is there, how much the fluid is there. So these all things you should know. Then only you can able to treat. But in the palliative care patients, if you take a proper history, you have to understand whether there is any. You should know whether there is any there is lymphedema or other edema. Coming to the problems, just imagine one limb is normal, the another limb is huge because of the lymphatic fluid volume. The lymph that one arm is huge. If there is fluid volume will be increased, definitely the pain and discomfort will be there. The maximum our skin will stretch because the fluid load will be increasing in our interstitial space. Definitely the skin will stretch whatever they can. But after that, after a period of time, the patients will develop pain and discomfort. And tightness will be there, heaviness will be there. They are not able to move the lymph independently because of the heavy weights. Fatigue will be there, numbness will be there, impaired mobility, loss of functions. These all will be affecting if the patient is having lymphedema. Okay, so loss of functions will be there, impaired mobility will be there. If there is a if one lymph is not functioning properly, just imagine how the things is going. If she take things from the cupboard, just imagine it's little bit heavy. She need 2 arms, but if one arm is huge, she can't. She need to help. She need help. So here, loss of independence, body image, sometimes change of employment. She is not able to continue. She or he is not able to continue the same job because of his or her disease condition. Difficulty in wearing clothes and shoes. Finally, she will be anxious or depressed because why I'm getting this kind of disease? My problems will be worsening. Finally, the patients will go to depression and then social isolation. Society will not accept because of her sin. God punish her like this. These kind of words will be pointing out. And then the society, like neighbors or social, that community people are not willing to see this kind of patients because of sometimes misconception will be there. It might be spreading to one person to another. That kind of misconception will be there. And another major part is constant remainder of disease, because we all know that if there is any total, if the patient underwent a total mastectomy there, definitely the person will develop lymphedema, but the patient doesn't know. If the edema will be starting in the arm, they might be thinking like, okay, my disease is spreading from my breast to my arm. These kind of things will be there. So what you can do is, when they come to you for lymphedema management, just sit down and listen. You have to take a proper history and make them understand why the lymphedema is developed. That important things you should tell the patient. We can manage somehow, but they should understand how the lymphedema developed. Moving on to the management part. So there are four major principles of management. The first one is skin care. We have to tell the patient about skin care because there is a chance of getting infections. So they need to take care of the skin, that particularly the affected skin well. And next principle is massage. You can do manual lymphatic drainage for that patients. As I mentioned earlier, if they have a edema on their one arm, if the left arm will be affected, our duty to push the fluid from the left arm to the chest area. So from into the chest area, regions, there are a lot of lymph nodes are there. So our duty to push the fluid from the affected area to the non-affected area. Once you push the fluid from the affected area to the non-affected area, the other lymph nodes will be ready to carry the lymphatic fluid from the affected part. Okay, so you have to know how to do the massage. And after the massage, you can do the compression bandage. You have to give a proper bandage. And then after bandaging, they should do some kind of exercise. Whatever they can, they have to. Once you do the exercise after bandaging, definitely because of the bandaging, the pressure, definitely the fluid will move up. And intermittent pneumatic compression pump is also the another option to manage lymphedema. So before massaging, I'll tell you the skin care later. Here measurement. We have to take a measurement first. We don't know how much volume is there in the affected lymph or that what is the normal lymph pattern and all. So we should take both affected and unaffected lymph. Okay, so you have to give a comfortable position to the patient, and then the first measurement from the angle from the head of the ulna. The head of the ulna plus 2 centimeter, then every 2 centimeter. The first measurement for the upper arm, for the first measurement from the head of the ulna plus 2 centimeter. Then from that point, every 4 centimeter. For the lower limbs, angle joints plus 2 centimeter, then every 2 centimeter, every 4 centimeter. We have a video on that. I'll show you later. Okay, so this is how we take a measurement. Then skin care. Always you have to tell the patient about the skin care. They have to apply simple moisturizing cream, not just before the massaging. After bathing, they can apply some moisturizing cream in the affected area. And meticulous drying between the digits, because if the lymphedema develops, there is a chance of accumulation of dirt into the digits, in between the digits. So you have to give a special attention on that area. If the dirts are accumulated in the digits, there is a chance of developing fungal infection. Okay, and then how to tell the patient about not take any injections or any venipuncture on that area, because if there is any infection developed, there is a chance of cellulitis. And avoid ulcers, avoid blood pressure cuffs. These all will be affecting the collaterals. And avoid injury. If there is accidental injury there, small cut there, they have to keep that area clean and dry. If there is any signs and symptoms of inflammation, they should go to the doctor and take a course of antibiotics. Otherwise, cellulitis will be developed. And also you have to tell the patient to, they should not take heavy weights, heavy things, because If they take heavy weights, what happens? The circulations will be increasing. Our circulation will increase. What happens? The arterial and venous capillaries will be communicating together more, and there is a chance of edema. So they should take small weights instead of heavy weights. And the next thing is massage. There are two different types of massage. One is manual lymphatic drainage, and the second one is simple lymphatic drainage. The manual lymphatic drainage should be done by a trained professional, nurse or a doctor or a physiotherapist. These are the trained professionals. Okay. So you should know how much pressure is needed for that affected area. If they apply more pressure on that area, what happens? Our circulation will increase and there is a chance of more edema. So we all know that how much pressure is needed for moving the fluid from the interstitial space, one place to another. So the lymphatic fluids are into the interstitial space. So gentle pressure is enough for moving fluid from one place to another place. Okay. Before massage, they should take a deep breathing exercise. Because if they take a deep breathing exercise, all lymph nodes will be stimulated. Okay. So why we are doing the deep breathing exercises? We are going to push the fluid, extra fluid from the excess fluid from the affected area to the non-affected area. They will be ready to, we need to prepare the healthy lymph nodes well before moving the fluid from the one area, affected area to the non-affected area. Okay. After deep breathing exercise, you have to stimulate the superficial lymph nodes. And after that, you can stimulate the unaffected node. For example, if I have developed lymphedema on my left arm, you have to stimulate my right axillary lymph node because the left axillary lymph nodes are already removed. There is no lymph node in my left axilla. So you have to stimulate the right side axillary lymph node. Then you have to massage the fluid from the proximal part to the you have to distal part to the proximal part. You have to clear the proximal part first and then go to the distal part. Okay, you have to clear the proximal part lymphatic fluid first and then go to the distal part. Always apply gentle pressure. Your gentle pressure is enough for moving the fluid from the lymphatic area to the one space to the next space. You can see that picture. There are a lot of lymph nodes, the greenish color. Okay. If you apply, if that is where I was telling about stimulate the superficial lymph nodes. Okay. You can stimulate the superficial lymph nodes and then stimulate the unaffected node and then you can massage from the proximal part first and then go to the distal part. So what are the contraindications? One is acute cellulitis. If there is acute cellulitis there, definitely the patients will be having pain. They'll have a discomfort. Once the cellulitis is comes down, then you can think about the massage. If there is any cellulitis there, you have to give some antibiotics for that. Then renal failure. If you have to think about if there is any renal failure there, you are going to push the fluid from the one area to the another area. So there is a chance of fluid overload. In a healthy person, you can do it. If the patient is having renal failure, you can't. And then unstable hypertension. Again, the patients will develop fluid overload. and then severe cardiac insufficiency, hepatic cirrhosis, and superior vena cava obstruction. So superior vena cava obstruction is one of the palliative care emergencies. If they have a heart and cancers, there is a chance of superior vena cava obstruction. If there is any these kind of things there, you should not do manual lymphatic drainage. So next we can see a video on manual lymphatic drainage. I'll show you. I hope you all clear with the manual lymphatic drainage. So as I discussed earlier, you have to take a measurement first, and then you can advise the patient to take a deep breath exercise, and then you stimulate the superficial lymph nodes and that opposite side of the non-affected lymph node first, and then make a pathway for moving the fluid from the affected area to the non-affected area. Then after clearing the proximal part and then goes to the distal part, after that it finish with the deep breath exercise again. So after manual lymphatic drainage, you have to do the bandaging. So either if the edema is unilateral, you can think about the stockings. Okay, so stocking is also a good good way to control lymphedema. If they are using stockings, they should remove at night, because the stockings, the elasticity is little bit high. Once the edema comes down, it will affect the circulation. So during the sleeping time, they should remove the stockings. Here, if they don't use the stockings, you can suggest bandaging the like crepe bandage. They can use a crepe bandage. Initially, what we do is, we will after the massage manual lymphatic drainage, we will do the spiral bandage. So after 2 weeks, they will come for review. And if the patient is able to tolerate the spiral bandaging, then we will do the figure of 8 bandaging, multi-layer bandaging. Okay, so this is how we manage the patient is having lymphedema. And for the legs also, the same thing. Initially, we will do the spiral bandage. After 2 weeks, if they are tolerating, we will think about the figure of 8 bandage or a multi-layer bandage. Okay, I'll show you a video on that also. Then we will discuss. Okay, so after massaging, you have to do the bandaging, and then you have to train the patient for exercise also. You all see that video. After the bandaging, you should educate the patient about exercise. It will help to move the fluid from the affected area to the non-affected area. Okay, so the simple exercise you can encourage a patient. So small that exercise is enough for this, and you have to think about if they are not able to do the exercise their own, you have to do it, or you can train the caregivers for the same. And as I mentioned earlier, there is one of the management of lymphedema is intermittent pneumatic compression pump. If the patient is having stage 1 lymphedema, then you can think about this also. This is as a electrical air compression pump attached to the inflatable plastic garment. If the patient is having lymphedema on their lower legs or upper arms, you have to insert that affected area into that inflatable plastic garment. So, and then after that, we can, there is a machine there, we can adjust the pressure, and you can adjust the duration also. It will be giving a continuous compressions, like the BP, that is sphygmomanometer cuff. No, if you apply that cuff on that your arm, then you have to inflate. So you have to pump the blood. No, that's so that time the cuff will be compressing our skin, that area. So this is how the electrical air compression pump is working. So there is a continuous the compression pressure will be there. So this will help to move the fluid from the affected area to the non-affected area. There are two major complications of lymphedema. The first one is cellulitis, and the one is lymphoria. So cellulitis is acute inflammatory episode. If the infection, if there is a inflammation, signs and symptoms of infection there, you have to refer the patient to the physician and make sure that the patient is taking antibiotic. So usually it could be streptococcal, but sometimes staphylococcus infection also. If there is any signs and symptoms if the patient is having cellulitis there, definitely they will have a pain, swelling, warmth, redness. These all things will be there. Fever will be there, headache will be there, vomiting will be there. So the first line antibiotic is amoxicillin. How to make them understand that what is the importance of taking antibiotics for that. Otherwise, cellulitis will be developed. And the next complication is lymphoria. Lymphoria is leakage of lymphatic fluid from the lymphedema area. Okay, that is lymphoria. If the patient is having lymphoria there, what you can do is you have to put a dressing pad, Gamgee pad over that area, and then you can give a same spiral bandage. Apply spiral bandage on that area. If you apply more pressure on that area, definitely the extra fluids will come out. Thank you. Anybody have any doubts on this? Please ask. Anybody?
Yes, I have one question. I'm wondering, is the massage typically painful for the patient, or does it feel good?
Sarah, can you repeat the question again?
Yes, I'm wondering, is the massage typically painful for the patient?
No.
Should we stop? Okay, should we stop massage if it's painful?
No, it's not painful.
Okay.
No. If the patient is having cellulitis, definitely the patients will have pain. If they have pain, you have to treat the pain first, and then you can do the manual lymphatic drainage.
Okay, thank you.
Okay. Thank you. Thank you for asking that question. How many of you have seen lymphedema patients? Okay. Only one person? So, Sani is asking, does the massage applicable for stage 2 and stage 3 lymphedema? No, you have to start from the stage 1 itself. If the patient is developing lymphedema, you have to start massage. You have to train the patient too. Sony is asking bandages are to be wrapped tightly or not. You have to give the simple pressure on that area because our aim is to move the fluid from the edematous area to the non-affected, non-edematous area. Because if you don't give a adequate pressure on that area, the fluid is not gone, not moved properly. So you have to give some pressure on while you are applying the bandaging. Because if you apply too much air pressure on that area, definitely the circulation will be affecting. That is why whenever you have seen that video, the fingernails you should not cover while you are doing the bandaging, because if the bandaging is too tight, the bluish discoloration will be there. So you have to give some pressure on that area, otherwise the fluid should not move. Yes, Michael is asking, can elevate the affected team reduce lymphedema? Thank you for asking that question. After massaging and bandaging, after doing the management part, you have to tell the patient to that lift up the affected arm, because you have to put 1 or 2 pillows under that area and that keep the arm up, because if you keep the arm up, definitely the fluid will move freely. Mukisha, how efficient bandaging? I can't understand the question. Leela Gandhi ma'am is asking, have you got to elevate the foot before applying? Before applying, you should not elevate. After bandaging and exercise, you should lift the lower limbs with the 1 or 2 pillows. But before giving bandaging or manual lymphatic drainage, you have to give a comfortable position to the patient. That time, if you want, you can keep a pillow under that affected area. Okay, Mukisha.
Yes, I was asking, how efficient is the pressure bandaging? How like, does it really work? How is the prognosis of using the bandaging?
Yeah. In our system, this is a good results. We got a good results from this management. That is why we created this video. Yeah, we have doing the same management for our patients. We have a lot of lymphedema patients. They will get good relief.
Once the bandage is removed, does the swelling come up again?
No. They have to continue. They have to continue the bandaging. Once the edema is reduced, they have to do some massage fully. No need to apply bandages every day. Once the edema comes down, they can do some massages and deep breathing exercise, and they have to maintain proper skincare and all. During walking, need to support the arm with sling. No need to support. If the arm is too heavy, definitely they will support. They will support their, no need to give a sling. They will support from their non-affected legs. They have to do their own. The Sushma ma'am is asking, can we do both practice like bandage and exercise, all types of lymphedema? Yes, this is how, if any lymphedema there, these are the 4 principles of management: skin care, massage, bandaging, and exercise. So after that, you have to tell the patient to elevate the affected area. Okay. So if you don't have any more questions, I have one question. I have one question I will ask you.
Ma'am, I have a question.
Hmm.
If the case is chronic, what shall we do?
Chronic. No,
Yeah.
the same way. No different management. You have to, if the patient, the 3rd stage lymphedema there, you have to do same way only. Sometimes the patients will have pain. That time you have to do some pain management, and then you can think about the management part. But the management is same.
Ma'am, sometimes what happens is that the fluid oozes out from the site.
Yeah.
Then
That is lymphoria. I was discussing on that, lymphoria, oozing out of excess fluid from that area. What you can do is you can apply a dressing pad over that area, and then you can do the same club bandaging. If you apply more pressure on that area, definitely the extra fluid will come out.
ma'am, after even doing the bandaging, if not reduces the that swelling, what shall we, lymphedema, what shall we do? Because I had a patient who had the same kind of lymphedema, so we had tried this bandaging. Actually, we had done only the bandaging, the massaging part.
What you can do is you can do the massaging first, and then you can do the bandaging. Start with the deep breathing exercise, stimulate the superficial lymph nodes, and then opposite side of the stimulate the opposite side of the unaffected area. Then you can do the massage from the proximal area to the distal area. That time the all lymph interstitial space fluid will be loosened, and then if you after that you can apply bandaging. Definitely the fluid will move. Okay.
Ma'am. Thank you, ma'am.
Please do it and try. If you have any doubts, please call me.
Okay, ma'am.
Okay. Thank you. Okay. We were discussing about the manual lymphatic drainage. As I already mentioned, manual lymphatic drainage is done by only the trained professionals. Within the hospital, we all there, we will take care of them well. But when they go home, who will take care of that part? How will they manage? They have to, we need to discharge from the patient, from the hospital. Definitely the doctor will discharge. So after that, they have to maintain a lymphedema management, right? How will they manage? Any idea? Mukisha is asking one question: can diuretics be helpful? It will not help. Sushma ma'am is asking, just like physiotherapist. It's physiotherapist also is doing the lymphedema management. Educate the caregivers, train the caregiver before discharge, train drainage back. But I already said they should not touch the affected area. Only the trained professionals will touch the affected area. Then how will you teach? So we should know what are the things we need to educate the caregivers. Okay. They should do skin care. They have to maintain proper skin care. They have to do simple lymphatic drainage. They can take deep breathing exercise. They can able to stimulate the superficial lymph nodes. They can do bandaging and they can do exercise. They should not apply pressure on their affected area, because if they apply, you will teach well, but they don't know how much pressure is needed for that area. We know simple pressure is enough. Even you teach well, when they go home, they will apply more pressure, because their idea is okay, the edema comes down anyway. Okay, if you give a more pressure on that area, they might be thinking like that. If you give more pressure on that area, the fluid will move gone. If you apply more pressure on that area, what happened? We know more capillary filtration will be there again. Rebound edema will be there. So they should not touch the affected area. So I have a video on that, the simple lymphatic drainage. I'll show you. This is not a final video. The editing work is going on, but you will get an idea about this.
Arm, Part 3. Simple lymphatic drainage of the arm. Rama is getting discharged. She will be taught the technique of simple lymphatic drainage by Sister Reshma. It is a simplified version.
Okay, thank you. I think it's clear to everyone what is simple lymphatic drainage and what is manual lymphatic drainage. Any questions?
Okay, so
if you don't have any questions, we can wind up the session. Anybody have any questions? If you have any questions or any doubts, if you when you have see a patient in lymphedema, please call me. I will help you. Okay, thank you. Thank you.
okay, so we are winding up our section. Thank you, Sheeba ma'am, for your fruitful section on lymphedema, and thank you all for joining us. This is SS Sanup signing out from this section. Thank you all for joining us. Thank you. Bye.